I've spent years trying to understand my skin, and there is something strangely symbolic about taking down my cornrows as I tell this story. It feels like I am peeling back all the layers I used to hide behind. So today, I want to finally talk about the skin condition I have lived with quietly for years, Pityriasis Lichenoides Chronica, or PLC. It's a mouthful, I know, but when something affects your confidence, your choices, and how you show up in the world, you learn the name fast. And if you've never heard of it before, don't worry. For the longest time, I hadn't either. What is PLC? Let's start simple. PLC is a rare chronic inflammatory skin condition or disorder. In plain language, your immune system decides to act up and your skin becomes the messenger. The condition creates small patches or spots. They can look reddish, brownish, or grayish depending on your skin tone. In darker skin, they sometimes show up as dark marks or white patches that sticks around even after a flare heals. The spots appears in cycles. New ones show up, old ones dry, peel, fade, and then another set comes. It's like the skin is on its own schedule. And the frustrating part, it is not contagious, not caused by death, not caused by bad lifestyle, not something you triggered. But people don't know that, and sometimes their reactions hurt more than the condition itself. What causes PLC? Now this is where it gets tricky. Doctors still don't know the exact cause. PLC seems to fall into a strange gray area in dermatology. Here are the leading theories. 1. Immune system overreaction. Some researchers believe PLC is the skin's version of an overreactive immune response, like your body reacting too strongly to something harmless, which is strongly suspected in my case. Number 2, a post-viral response. A few studies show that some people develop PLC after infections like Epstein-Barr virus, HIV, chickenpox, or even simple respiratory infections. Not everyone, but enough for scientists to notice a pattern. Now, the third one, a T cell-driven inflammatory process. This is just a fancy way of saying the immune cells that usually protect you get confused and start overreacting on the skin. Number 4, possible overlap with autoimmune behavior. PLC isn't classified as an autoimmune disease, but it's a behavior that resembles one, long-term, unpredictable, and deeply connected to the immune activity. And here is the truth nobody likes to say. Sometimes the cause will never be clear, and living with uncertainty is its own emotional journey. Who gets PLC? PLC can happen at any age. It's seen in children, adults, men, and women. But here is where it gets frustrating. Most research is done on lighter skin. That means diagnosis is often delayed in black women. Symptoms look different on darker tones. Medical pictures online don't match what you see on your own body, and many doctors mislabel it as eczema, allergies, fungal infection, or post-inflammatory hyperpigmentation or hypopigmentation. So when a black woman has PLC, it often takes longer to get answers, and that delay affects confidence, self-esteem, and even mental health. There are no large-scale statistics specifically for black women because PLC is rare and underreported. But dermatologists have said for years that pigment-related skin conditions tend to be misdiagnosed the most in US. What living with PLC feels like. It's easy for someone to see the marks and think, oh, it's just spots. But anyone living with PLC knows it's more than that. You get cycles like this. New spot appears. They scale or peel. They itch lightly or sometimes not at all. Then they darken. Then they leave marks like hypopigmentation or hyperpigmentation. Then the whole thing repeats. And the worst part is not always the appearance, it's the unpredictability. You can wake up clear on Monday and wake up flaring by Thursday. You can prepare for an event feeling confident, then suddenly develop new spots overnight. And then there is the emotional side, the shame, the explanations, the comments, the staring, the jokes. People don't talk about that enough. How is it diagnosed? PLC is usually diagnosed through a combination of a close skin examination, your history of flare-up patterns, and a skin biopsy. In my case, I had a couple of blood tests and a biopsy. A biopsy is often the only way to confirm PLC because the skin tissue shows a very specific pattern under the microscope. Most people go through several misdiagnoses before reaching PLC. I went through this firsthand. So, if you've been given steroid creams, antifungal creams, antibiotics, moisturizers, allergy meds, and nothing worked, you are not alone. It's common. And because PLC is so rare, sometimes the diagnosis comes with more questions than answers. If I got $1 for every time someone asks me what are the treatments for PLC, I'd probably be a millionaire by now. So what are the treatment options? There is no guaranteed cure, but here are several ways doctors manage it. 1. Topical steroids. This help with inflammation during flare-ups. They won't prevent PLC long-term, but they can calm episodes. This is one of the most effective treatments. Dermatologists use controlled UV light to reduce inflammation and help lesions to heal faster. The third one is antibiotics with anti-inflammatory effects. Number 4 is immune modulating meds. For stubborn cases, doctors may use medicines that calm the immune system. Number 5, moisturizers and gentle skin care. Not a treatment for the disease itself, but it helps the skin barrier stay healthy. Number 6, staying consistent. Because PLC comes in cycles, treatment often means managing patterns, not just flares. Will it ever go away? Here's the part people really want to know. PLC can last months, years, or come and go throughout life. Some people go into long remission, some improve gradually with treatment. Some people, like me, learn to manage it like a chronic condition. Either way, having the diagnosis is already step 1 towards control. And now, let me bring this back to me. Living with PLC has been a journey. There were days I didn't want to leave the house. Days I felt like I needed to explain myself before anyone asked. Days I let clothes, hairstyles, and lighting control my confidence. I've had moments where I stared at my reflection and wondered why my skin couldn't just behave like everyone else's. I have cried over flare-ups that came out of nowhere. I have smiled through comments that weren't funny, and I have spent years feeling like my skin spoke louder than my personality. But getting the diagnosis gave me language. It gave me a way to say, this is what is happening, and it has a name. And slowly, I stopped hiding. Slowly, I started reclaiming my beauty. Slowly, I realized that my skin condition is part of me, but it isn't me. This is another step in that process. So if you are watching this and you have PLC or any other chronic skin condition, I hope my story reminds you that you are not alone. You deserve to feel seen, you deserve care, you deserve answers, and your beauty, your real beauty, was never up for debate. So if you're a skin girly, a skin condition girly, a woman who has a chronic skin condition, please do well to follow my journey. This is actually my first video on here. I actually hope that you watched it till this level. See you all in my next video. Bye.